Hi, this is Tay with Thinking with Tay, and we have today with us Mrs. Lawanna Gaddy of LTMG Consulting. Today we're going to be talking about the topic today is bridging the gap care management innovations to serve minority communities. Hi, Lawanna, how are you?
Good morning. I'm good. How are you doing?
Good. Thank you for being here with Thinking with Tay and myself today. We are excited about this topic because, one, we understand that this month is a Minority Health Awareness Month. And being as though it's a critical, healthcare is a critical component and need in minority communities as well as communities at large. And we wanted to bring you here today and to hear from you in terms of your specialty with respect to case management, and so that you can guide us essentially and help everyone better understand that need and the gaps therein.
Thank you for
Okay,
having me. I'm excited.
absolutely. Thank you so much. And we want to make sure that everyone gets an opportunity to get to know you. So I'm just going to share with everyone here. Lawanna is a graduate of the University of North Carolina at Greensboro with a bachelor's degree in nursing. She also has a master's degree in nursing administration from East Carolina University. She also, a lot, honey, she's qualified. She is also a certified case manager with an extensive background in care management and leadership within managed care, particularly in Medicaid populations. Lawanna excels in driving quality care and ensuring healthcare excellence. As a registered nurse and certified case manager, she is deeply committed to empowering case managers with the tools necessary for success. Her expertise emphasizes the critical role of quality documentation in achieving healthcare accreditation and improving patient outcomes. Passionate about the impact of effective care management, Lawanna inspires professionals to enhance both client benefits and organizational performance through robust educational and practical strategies. That is awesome. Hear ye, Lawanna Gaddy. Lawanna, we're going to just move and dive right on in because this is a topic that certainly everyone needs to hear. And we again are excited about having you here.
Thank you. Thank you.
Great. So, Lawanna, when did you find that you were interested in becoming a nurse?
Oh man, I remember my first volunteering experience. I was a candy striper in the hospital.
Okay.
I used to see the nurses taking care of patients, and I was like, I can do this.
Yes, you
I just loved the idea of being that person to help someone when they need it most, even as a child. So I
can.
remember that experience.
Yes, awesome. That's beautiful. It's interesting. My aunt started as out as a candy striper, and I think she worked in healthcare for like 40 years after that. And of course,
Nice.
I have several cousins and family members in medicine. I commend you all. I mean, because it takes a special person to be able to take care of others in such an impactful way. So thank you for that.
Thank you.
Was there a particular reason you chose nursing as a career path? Sometimes
Mhm.
I've heard from other people that their grandmother was sick or a family relative, or there may have just been an experience that impacted them most where they said, I want to be a nurse. Was there something that triggered you or something you felt like or gave you a reason to become a nurse other than maybe being exposed in the candy striper, business or profession?
Yeah. So, like I said, I always wanted to go into a field where I was caring for people.
Mm-hmm.
I'm the oldest of six, so I feel like I've been a caregiver like from the beginning.
Okay.
It does kind of nourish me though when I'm caring for
Okay.
people. I
Yes.
remember when I was in elementary school, like I used to want to be a pediatrician, but then as I got
Oh,
older,
yes.
yeah, I realized that nursing was kind of where I needed to be.
Okay.
Um, I could have a bigger impact on patients. I remember when my sister was in the hospital, the
Yes.
nurses were there with her at the bedside, taking care of her. And it was just those nurses that they were there, right? They were providing the
Yes.
education, the resources. And it was like,
Yes.
all right, this is the lasting change that I could make. It was where I wanted to be.
Absolutely. Absolutely. That's awesome. So what field of nursing did you begin your nursing career?
Yes. When I was in college, my thought was I was going to be a pediatric nurse practitioner. So
Mm-hmm.
when I got my first job at Wake Forest Baptist,
Okay.
there were no pediatric positions available. So I had to start out in adult med surge. So I was
Oh,
taking care of all kind of patients, seeing
oh
all kind of,
my.
I know. I did that for about a year, and then I transferred into the pediatric med surge population too. So yeah.
Okay. Okay. I imagine that was, I mean, critical care provision, and I know that was pretty tough. Sometimes seeing medical surgery, that's like surgery, right?
So med surge is like all types of patients. It's just like a general floor. So it's
Oh,
not critical care, but it's kind of they can get all kind of patients. So you could be in
okay.
there for like diabetic ketoacidosis or something, and then you could also
Oh,
for having like a procedure and you're doing
yes.
some recovery. You could be over there too. So we just saw a whole wide
Oh,
variety of.
well, you got a lot of experience, sounds like. You was kind
Absolutely.
of thrown into it.
Yes.
Okay, great. So it sounds like and that was my next question. You've worked in a hospital setting. How long did you work in a hospital setting?
I did. Like I was always told that after you graduate college, you pass your nursing exam, going into the hospital was like what you should do. You should go into
Oh,
the
okay.
hospital, get the
Okay.
bedside experience. So I worked in the hospital for 2 years, and it
Okay.
really solidified the fact that I was not cut out to be a bedside nurse at
You know,
all.
I've heard people say that. I've heard people say that. And it's like,
A
ooh,
huge shout out to all those bedside nurses because it takes a special person to do that.
yes.
They are the real MVPs.
All right. All right. Hey, we all need to know where our strengths are. I mean, I know where mine is as well. And you're absolutely right. I get that. So tell me, how did you get into case management?
Yes. When I left the hospital after my 2 years, I had no idea like what I was going to do. I
Okay.
didn't know of any other types of nursing really that were available. I didn't
Okay.
know that nurses were in so many industries.
Okay.
Um, So my first case management role was in a program called the Nurse Family Partnership. It
Oh,
was a startup. It was new at the time to Mecklenburg County.
okay.
And when it rolled out, I was doing home visits with first time pregnant young women. Um,
Mm,
the goal was to like help them be successful with their pregnancy outcomes,
okay.
attending prenatal appointments, having a successful pregnancy, continue with school because a lot of them were still in school.
Yes.
And then when the baby was born, I'd provide case management to the moms to help them develop good parenting skills, nurture
Yes.
the bonds with their child, connect them to
Wow.
resources out in the community. And that really
Wow.
was my first taste of case management, really.
Awesome. Awesome. That was certainly impactful. And you saw an immediate, I'll say, effect that you probably had on your patients during that time.
Absolutely, absolutely.
Mm-hmm.
I have a lot of
Yes.
stories. It was, but it was a good experience overall.
Oh, I bet so. I'm sure it was. So now tell me about LTMG Consulting.
Yes. So LTMG Healthcare Consulting was born out of my passion for case management. I love case management. I've been in
Yes.
case management for a long time. I've seen case management in the community, in the hospital, and managed care, and I know that there needs to be a certain quality standard in place whenever you have a
Yes.
case management program. So,
Mm-hmm.
in my 18 years of experience, I've seen that we were still missing the mark with those quality standards in place
Mm,
for the care management programs.
okay.
Documentation was not sufficient to meet accreditation standards. I wanted to do something about that. I wanted
Mm,
to share my knowledge with healthcare organizations who need it. And I was like, all right, let's do this. And I just dove right in there. I was like, all
okay.
right, there are organizations out there who need my expertise, and I want to be
Absolutely.
able to provide
Absolutely. Very
it.
good. And certainly a need, just like A.G. Gaston, his motto, a pioneer many years ago in business, he said, find a need and fill it. That was a very critical quote of his. And I certainly believe that there's a need out there, especially if, with the experience that we have in our various fields, if you can find an opportunity to consult and provide your experience to help and make a major impact in that industry, that's the best thing you can do, especially leading into maybe the latter years of your career. So that's excellent. Now tell me what LTMG stands for.
That is my whole name, my maiden name, my married name, my middle name. It was
I love it.
like how do I kind of put my business out there and leave my legacy?
I like
And I
that.
didn't want to leave my maiden self out. So I was like, all right, we're gonna include the whole self because it makes up who I am. So
Absolutely. It didn't just start with the marriage. This was a process in the making. So you wanted to include everything. And I like that because it's holistic. You're saying it's all of me, and I'm
yeah,
pouring all of me into my business. So this is beautiful. And I'm extremely elated that you decided to do that. So great. All
thank you.
right. So what is and I think you shared this, just like your key business objective. You said to help corporations. You saw that there was a need, a lack or a gap
Yeah,
there
for
therein.
sure. So yeah.
So
So yeah,
I'm sorry, go ahead.
no problem. My objective is really to help healthcare organizations who are striving for that NCQA excellence. And that
Okay.
is the National Committee for Quality Assurance. They really
Okay.
set the standard. It's a major accredited body in healthcare, especially care management and managed care. So I help those organizations implement quality care management programs to help prevent noncompliance and associated financial burdens, especially when there's contractual stipulations in place. I want to make sure that those organizations are following the guidelines to the T.
Gosh. Oh, that is so basically it's really almost like audit and compliance.
Kinda, yeah. There's a component to it.
Yeah,
Yeah,
there's a component to that. I know
there's a
from my that's a legal ear that I'm hearing. I'm like, you're auditing and making sure that they're following standard protocol procedures, standard operating procedures, and that type of thing with respect to the laws. Pretty
yes,
good.
and
All
providing the
right.
education where the gap is identified. Yes.
I love that. Okay. Okay. So tell me, what do you, from your perspective, identify as being the main health concerns among minorities?
Yeah. So among minorities, some of the main concerns are higher rates of chronic conditions, diabetes,
Mm,
hypertension, obesity. We used to hear our grandparents saying, I have sugar and I have the
yes.
high blood.
Yes. Yes.
Those are some of the main concerns. There
Okay.
are also health disparities when it comes to mental health, right? We still have those
That's
stigmas of
right. That's
I don't
right.
want to go talk to somebody and tell somebody my
Mm-hmm.
business. So
Mm-hmm.
those are
Mm-hmm.
also some of the concerns. I will say this is where care management can really help these patients.
Okay.
Care managers provide that education, they provide that support about how to manage your chronic conditions. They
Okay.
discuss medications with patients to ensure that patients are compliant with taking medicines, but also telling them, like, why am I taking it? Helping to make sure that the patients
Mm,
are aware. Because when
mm.
patients understand, they're engaged, the compliance is increased, and
Yes.
that means that they're helping to manage their conditions better.
Oh my goodness, that's awesome. And that component, certainly that case management is essential, because you're
Mhm.
right, that educational component, because sometimes, we often don't like to take medication. So, but if you understand the need and the
Mhm.
objective behind it, and what it's targeting, and understanding how it will benefit us in the future and hopefully improve our lives, then we probably would be more inclined to take it and take it consistently.
Right. Exactly.
So tell me, what do you feel is the cause of such health concerns, the ones that you've named in the minority community?
Yeah. So the causes of the health concerns, it's a complex just interplay of all kind of factors. Social
Okay.
economic challenges, environmental exposures, limited access to healthcare, cultural
Mm-hmm.
barriers, health
Mm-hmm.
literacy. Um,
Mm.
yeah, so those are definitely some of the big issues with minority patients. Care
Okay.
management, again, can definitely help with addressing some of those underlying concerns. Care managers can
Yes.
help connect patients to available community resources to address those SDOH, those social determinant of health needs.
Okay.
Um, because if a patient, like if you can't take care of your basic SDOH needs, then how can I expect you to take care of your health, right? If you don't have food or money
Interesting.
to pay for your rent, how can I expect you
Wow.
to go out and buy your medication? So case managers
Wow.
definitely can help address those underlying needs.
Wow. Wow. That's amazing, because you raise a really good point, because aside from your health care, I mean, do you even have a house to live in? Do you
Right.
have basic transportation?
Mm-hmm.
Essential needs, that just day-to-day needs that we all, need in order to even make it in life.
Exactly.
Healthcare ends up being probably a second, well, you hate to say that it is, as far as priority, because you're talking about just essential, healthcare, or not just healthcare concerns, but just basic needs.
Absolutely.
Wow. Wow. Wow, that's a good point.
Mm-hmm.
So, would you say that, I'll say, minority health concerns are primarily genetic? Can they be, like, when you say, as you
Mm-hmm.
said, the sugar in our family, diabetes, high blood pressure? Would you say that genetics play a part in that? And can
Yeah.
you?
Mhm. Yeah. So I think genetics really does play a part in some of those health conditions. They do,
Okay.
and too with like sickle cell. That's primarily in the African American communities. That's
Mm-hmm.
genetic. Um,
Okay.
rather to we do need to look at those other impacts: environmental, economic, social determinants of health, because if I am growing up in an environment where I am eating a lot of junk foods, a lot of sweets, of
Okay.
course that is going to impact my health. It's going to impact how I grow up, the things that I choose to eat. So
Mm.
patients, they can't really impact their genetic makeup, but they can
Mm-hmm.
definitely work with care managers to address those non-genetic factors that are
Okay.
impactable, and it can improve their health.
Okay. That's
Yeah.
great. You actually led right into that question, in terms of the next question I have, in terms of how do we mitigate those health concerns. And as you said, really education, not necessarily eating certain things as we're growing up. And sometimes we just don't know. And sometimes we just enjoy those foods that are not necessarily good for us.
Yes,
So, yeah. And
absolutely.
that's unfortunate, because I like a good Snicker here and there, and I like
You
good
both,
pizza.
okay?
But we have to know, essentially, that those things aren't, really good for us, and everything is okay, I guess, in moderation.
Inspiration. Yes. Yes. That is true. Um,
So,
and I feel like as far as mitigating health concerns, it requires really a multifaceted approach.
okay.
Increasing access to healthcare, improving education on health practices, addressing those social economical determinants,
Hmm.
tailoring health interventions to meet cultural needs of minority populations.
Hmm.
Care management speaks to the heart of that multidisciplinary approach. Care
Okay.
managers can help patients navigate the complexity of this healthcare system. They help educate patients on not only their health conditions, but they educate in a way that's culturally sensitive, in a simplified way
Mm,
so that the patient can understand. Care
awesome.
managers, they also like create care plans with the
Mm-hmm.
patient at the center. So that means the patient is involved in their care. It's not like you're telling me I need to do this, right? So
Yes.
the care manager involves the patient in their care. They focus on
Yes.
what's important to the patient, but also what's important for the patient. They put these goals in a care plan. They communicate these goals with the patient's providers so that the providers are also aware of what's going on with the patient
Okay.
in their home. So that care coordination is crucial to bridging those gaps so that patients are not lost in the system.
Oh my goodness. You guys do major impactful work. I mean, we can appreciate that because having that guide and someone or a point of reference with respect to your health care, and as you said, having a plan and following and be able to tap into that resource is an awesome thing and certainly a need and absolutely fills the gap. Because a lot of times we feel like doctors speak in medical terms that we don't really understand. So the healthcare managers are essential to everybody's healthcare. Awesome.
Absolutely. Mhm.
Okay. So tell me, what do you identify as the gaps between healthcare for minorities and non-minorities? I think we touched on this earlier. It may be the economical, the access. So
Yeah.
is there anything beyond that you can see that is a gap? I know a lot of times when we talk about, I mean, I know that there's healthcare available. We're talking about Medicaid, Medicare. We talk about the Obama Care Act and that type of things. But what would you say is between minorities, the gap between minorities and non-minorities?
Yeah. I think some gaps can include disparities in the quality of care received. Um, we see that a lot, especially I'm thinking about maternal health,
Yes.
and,
Yes.
looking at Black
Yes.
moms and their outcomes versus non-Black moms. So that's very unfortunate. Also, underrepresentation in clinical trials. Like if a trial is in place and minorities are not included in it, then how do we know that it's going to work for everyone?
Oh my
Um,
goodness.
yeah, less access to preventative services. That can also be a gap too. We don't. That's something that we would like to see more of. Is minority patients taking advantage of those preventative services, and like thinking about your mammogram, your
Mm-hmm.
colonoscopy,
Mm-hmm.
your Pap smear,
Mm-hmm.
all of those things that we dread, but they're very important to our overall
Yes.
health. Yeah.
Wow. Wow. Thank
Mhm.
you for that. That's some really good information. So let
Mhm.
me ask you, do you also find that technology plays a part? Of course, with my healthcare system, there's things like my chart. And sometimes, underprivileged communities and minorities may not have access to technology, or even if they do, they may not understand how to navigate those platforms.
Yeah, for sure. And with the wave of the future, technology is all increasing. So definitely those barriers are present if they don't have technology in place. It
Hmm.
also could be due to like the whole digital divide, language barriers,
Oh,
lack of tech
yes.
literacy,
Hmm.
especially in our older adults who may not be as
Hmm.
savvy as some of the younger ones. So yeah, when
Right.
there's that barrier with technology, it definitely can impact health.
Thank you. Yes.
Mhm.
Um, so let me ask you, what would be your recommendations for bridging some of these gaps?
Yeah. Um, Bridging the gaps, I definitely think that it calls for enhancing community programs,
Mm-hmm.
increasing funding for services in underserved areas,
Mm-hmm.
promoting diversity in healthcare staffing, um,
Awesome.
leveraging technology that is accessible and user
Mm-hmm.
friendly for all
Mm-hmm.
populations. And
Yes.
then also having organizations that have a solid run care management program in place.
Mm-hmm.
What does that look like? That's care managers who provide culturally sensitive, comprehensive assessments for patients.
Mm-hmm.
They're implementing person-centered care plans. They're coordinating care with patients and providers. They're
Mm-hmm.
connecting patients to community resources. These are really ways that I feel like we can bridge the gap with care management leading the charge.
Oh, excellent. And let me ask you, and I think this is critical. What then, a- in trying to meet the need of, the access, and the gap? So, what resources are available for non-insured citizens right now that you can think of?
Yes, that one can be a tough one. Um,
Yes.
Non-insured citizens can access resources like community health centers, free clinics, state health programs, charitable organizations, patient
Mhm.
assistance programs for medications are also available.
Okay.
Like this is where I would tap into my social work care managers. There are social work care managers out there who can help navigate. Also, my community health workers.
Okay.
These individuals are part of the care team. They can
Yes.
ensure that the patient's community needs are addressed. So I would definitely make sure that I'm tapping into those resources.
Excellent. Excellent. That's very good information. Now, this is a question I've heard, or and maybe it's a theory. You can let me know. So is every US citizen, is Medicare and Medicaid available to every US citizen?
Not all citizens qualify
Okay.
for Medicaid or Medicare. Medicaid is for low income individuals, where Medicare is for primarily individuals over 65 and those with certain disabilities. Um,
Mm,
I will say, I will give a plug for North Carolina because North Carolina has expanded their Medicaid to individuals with slightly higher income. So, of course, it's
okay.
income based. And this was
Yes.
effective December 23. So for those who live in North Carolina, they want to see if they qualify for Medicaid under the new expansion. They can definitely check out its website, medicaid.ncdhhs.gov, and they can
Perfect.
check out and yeah, see if they're qualified.
Okay. Okay. And you've already addressed that was my next question, which you've already addressed in terms of the eligibility for Medicaid and Medicare. So thank you for that. You're ahead of the game. That was one of the questions I had. And as far as Obamacare, is that essentially the same thing? It's income based?
So, yes, Obamacare or the Affordable Care Act, it does
Yes.
provide this marketplace insurance options. It has some subsidies for those individuals who qualify based on their income.
Okay.
Not all individuals are eligible, though. Individuals can go to is www.healthcare.gov, and they
Okay.
can look into the Obamacare or Affordable Care Act and see if they are eligible for it.
Excellent. You are giving some, I mean, poignant information out here today. And I so appreciate you for this because I think it's going to help a lot of people when they, just knowing and understanding how they can gain access. You're giving website information, you're giving differentiations, eligibility requirements. This is awesome. And I really appreciate you for this. Um, so and we're getting ready to actually, we're closing out. And I just want to, ask you, how is there anything else you want to share with respect to LTMG healthcare consulting? Is there something else you want to share? And I know that you probably have platforms and how people can, maybe reach you. Can you share that? Or if you have anything else you want to add to what I've already asked?
Sure. Well, definitely thank you for having me on. It is very important to spotlight these issues. And what a wonderful time to do it is around Minority Health Month. So thank you for having me.
Absolutely.
Yes. So, yes, my socials, my website is ltmghealthcareconsultant.com.
Yes.
Feel free to check it out, book an appointment. Um,
Yes.
you can also follow me on LinkedIn at LTMG Healthcare, um, or Lawanna Gaddy on LinkedIn, and then LTMG Healthcare Consultant on Facebook and Instagram. So thank you.
Excellent. Thank you so much, Lawanna. It's been a pleasure speaking with you today. Again, you have provided some phenomenal information, very pertinent information that I think our listeners will be able to benefit from. Thank you so much for the great work that you do in our community and at large. We really appreciate you. We couldn't do it without you.
Thank you. Thank you for
Uh,
having me.
Absolutely. And to the listeners, thank you all again for joining Thinking with Tay today. And again, I'm trying to remind you that it's not that I am telling you what to think. I just want us to think critically about the things that we need in our communities and our lives. And I thank you so much. And until next time, goodbye.